This is the continuation of week 7, abdominal and thorax assessment. Jacob is still our patient. I came in the room, washed my hands, introduced myself. I'm going to ask Jacob to lie back.
Okay.
And make sure he's comfortable. I'm going to take this opportunity to assess his skin, which again is free of lesions, redness. There's no open areas, no scratches or anything like that. The umbilicus, there's no redness, irritation, or swelling present there. So I would say his skin is intact and it's normal. Now, Jacob, I'm going to listen to your belly, okay?
Okay.
When we do the abdominal assessment, we do not follow the standard IPPA sequence. We inspect, auscultate, percuss, and palpation as not to disturb bowel sounds in the belly, because if we palpate or percuss those first, we could increase the bowel sounds and potentially get a false hearing and miss something. So I'm going to begin with auscultation in the right lower quadrant where the ileocecal valve is, where there should always be 99% of the time bowel sounds. You can just breathe normally.
Okay.
Bowel sounds occur about 5 to 30 a minute, but there's no need to count them. They are cascading and tinkling. They are neither hyper or hypoactive. Hypoactive bowel sounds could indicate peritoneal inflammation, or that could be an expected finding following an abdominal surgery. If they were hyperactive, it would just be like growling, like you could hear audibly, maybe standing outside over here without the stethoscope. His are neither. They're very even. They're consistent. So again, you're normal in that assessment as well. So I'm going to take the opportunity now to listen to vascular sounds. So I'm going to listen to your aorta, your renal arteries, your iliac arteries, and your femoral arteries, okay?
All right. Awesome.
And I'm going to cover you up with a sheet. And what I'm listening for here is the presence of a bruit. If you hear a bruit, of course that's increased blood in that area, and that is not a finding that you want to have. And no presence of a bruit noted. So at this point, what I will do is I will begin using my hands now that I know that I won't disturb any noises or anything in your belly, okay?
All right.
Now, I'm going to just lightly put my hand on you and move in a clockwise motion around. I want you to tell me if you experience any tenderness or pain.
Okay.
Okay? Light palpitation occurs first. I can feel his xiphoid process here, and you shouldn't mistake that as a mass. I don't feel anything unusually large or out of place. Now I'm going to press a little bit deeper, okay? If Jacob were a large person or obese, I could use the bimanual technique, which I would press a little harder with this hand and still continue to palpate with the underneath hand, but I would need to go deeper. Any pain or tenderness?
No.
Good. Okay, good. Now, remember on your back where we tapped and made all that racket? All right, we're kind of going to do that now, okay?
Yeah.
Again, we're following the IAPP sequence in the abdominal assessment. So, I'm going to just tap my finger all over you, okay?
All right.
And now I'm gonna measure the span of your liver, okay? I'm gonna try to anyway. I need my pen, okay? All right, I have my measuring tape here. Now, I'm gonna just tap on you a little bit more, okay? And I'm gonna write on you.
Yeah.
All right. Now I'm going to come up from the abdominal area until I note dullness. I'm going to measure this. It is 3 centimeters, which this should be 2.5 to 5, I believe. So that's a normal finding as well. So I'm not suspicious of liver enlargement. All right. Now, had he expressed tenderness of when I was here in the area of the liver, I could perform the scratch test. Okay. So I would put my stethoscope over top of his liver and begin down here just lightly scratching him. And the noise becomes louder, about at the same bottom line that I checked before. However, you didn't indicate tenderness, so that test normally probably would not be performed unless the practitioner felt enlargement in the liver upon palpitation or percussion. All right, next we're going to go to your spleen. Okay, so I'm just going to reach across a little bit. And I can hear when the sound is changing. All right, any pain with that? Good. All right, next we're going to move on to your kidneys.
Okay.
So I'm going to ask you just to sit up for a moment. Okay. And what I'm going to do is place my hand on his flank area, and I'm going to hit my own hand with the ulnar side of my fist. Okay, ready?
Mm-hmm.
I need you to tell me if this is painful for you.
No.
Okay.
No.
All right, good. Okay, do you mind to lay back down?
Okay. Yeah.
All right, what I'm going to try to do now is palpate your liver.
Okay.
Okay? There are 2 methods. I could use the hooking method, which I would stand this way and put my fingers right under the margin of the ribs quite deeply and ask you to breathe. And I actually did feel your liver bump my fingers. Do it again. Okay, good.
Okay.
Now, I'm going to reach over and try to palpate the spleen. So I would reach across Jacob and again put my fingers on the border of the ribs, and I'm going to put this hand under for support, and I ask you to deep breathe. I should not feel anything, bumping my fingers. If I did, it could indicate enlargement of the spleen. Am I hurting you? I'm sorry. I know I was going pretty deep there, but I could feel it. Okay. So now we're going to try to palpate the kidneys. So
Okay.
I'm going to go in a duckbill fashion. Now I'm going to lift you up just a little bit, okay?
Yeah.
And I'm going to press really hard. And I don't feel anything. Same thing over
Okay.
here. Normally the left kidney is not palpable on an adult. And I do not feel anything there. Now, if any of the assessment conducted, he had said that he has pain, then I also could verify that pain with a couple of other tests. And one of those tests would be the Bloomberg test. So if he said he had pain perhaps in this region, I'm going to move my hand away from where he told me he had pain gonna pass rather deeply and come up quickly.
Remember that.
Okay, that would be rebound tenderness. There's also the Murphy's test that you can perform, and that's for the liver. So I'm going to reach under here a little hard again, okay, and ask you to take,
Breath.
yes, inspiration. Now, he is negative because had he been positive, he would have abruptly stopped breathing in that inhalation because the sharp pain would have been too much. Lastly, I'm going to assess his aorta. So I'm going to go just a little left of the midline here. I'm going to use my finger and thumb. And I'm going to cheat and listen for it first. And I can feel his pulsations under my fingers. They're very even. I can't visibly see them out here. His aorta does not feel enlarged. All right, Jacob, you did a fine job. Thank you so much.
Yeah, you too. Thanks a lot.